Hi, moms and dads. Have you ever noticed your little one struggling to poop? Maybe your baby looks uncomfortable, cries, or passes very hard stools. Constipation in babies is one of the most common worries parents have. But the truth is, constipation doesn't always mean not pooping every day. It's about the texture, difficulty, and comfort. In this video, I'm going to give you a complete guide to baby constipation, the causes, signs, natural remedies, when you should worry, and how to keep your baby's tummy healthy. Let's begin. What is constipation in babies? Constipation in babies is when stools are hard, dry, and difficult to pass. Even if your baby passes them every few days, some babies may go once in 2 or 3 days and still be normal if the stool is soft. What we worry about is straining, crying, and passing pellet like stools. For newborns and exclusively breastfed babies, constipation is actually rare because breast milk has a natural balance of nutrients and water. Formula fed babies and older babies starting solids are more prone to constipation. Causes of constipation in babies. Constipation can happen for many reasons, and knowing the cause helps you choose the right remedy. Breastfed babies. Rarely constipated, but sometimes if mom's diet is low in hydration or baby has an individual digestive pattern, stools may be less frequent. Formula fed babies. Formula is harder to digest than breast milk. Sometimes the brand of formula, preparation errors, or iron fortified formulas may cause constipation. Introduction of solids around 6 months. When solids begin, the baby's gut is adapting to new foods. Low water intake, especially after starting solids, babies need extra fluids. Without enough water, stools become dry. Illness or medications, fever, dehydration, antibiotics, or certain medicines can slow digestion. Lack of movement. Younger babies who are less active or swaddle for long may have slower bowel movements. Emotional or developmental reasons. Sometimes toddlers hold back stools due to pain, fear, or distraction, which makes constipation worse. Signs of constipation in babies. It's important to differentiate between normal straining and true constipation. Passing hard, pellet like stools, crying or arching back while trying to poop, less frequent bowel movements than usual, blood streaks in stool due to small tears, anal fissures, bloated belly or loss of appetite, baby refusing feeds or feeling irritable. Normal newborns may grunt, turn red, or strain but still pass soft stools. This is not constipation, it's just immature coordination. Now let's talk about natural remedies for baby constipation. For babies under 6 months, exclusively breastfed or formula fed, breastfed babies continue exclusive breastfeeding. Breast milk itself prevents constipation. If stools are genuinely hard, consult your doctor to rule out medical issues. Formula fed babies, check if you're preparing formula correctly, not too concentrated. Sometimes switching formula brand after doctor's advice helps. For babies over 6 months, when starting solids, offer water, small sips of water between meals. High fiber foods, pureed pears, prunes, peaches, plums, papaya, and peas are natural laxatives. Avoid constipating foods. Too much rice or dairy can worsen constipation. Offer oatmeal instead of rice cereal. Oats are easier to digest and have more fiber. Home remedies. Tummy massage. Gently massage in a clockwise motion to stimulate bowel movement. Bicycle legs. Lay baby on back and move legs like pedaling a cycle. Warm bath. Relaxes abdominal muscles and helps baby poop. Pea fruits. Prunes, pears, papaya, peaches. These naturally soften stools. Constipation in toddlers 1 year and above. As babies grow into toddlers, constipation can become more frequent, especially during potty training. Increase fruits, vegetables, whole grains. Increase water intake. Give physical activity, running, playing, and movement help digestion. Avoid excessive junk foods, processed snacks, or too much cow's milk. When to see a doctor? Most constipation is mild and improve with home remedies. But consult a pediatrician if constipation is persistent despite remedies, babies vomiting, refusing feeds, or very irritable. There is blood and stool often. Baby has not passed stool for more than 5 to 7 days with discomfort. Belly is swollen or baby has poor weight gain. In rare cases, constipation may be due to underlying medical conditions like hypothyroidism or food allergies. Preventing constipation. For newborns, exclusive breastfeeding is the best prevention. For formula fed babies, ensure correct preparation and discuss with the doctor if ongoing issues. For babies on solids, always balance solids with fiber and water. For toddlers, encourage daily fruits, vegetables, and physical activity. Establish a routine. Set regular potty times to avoid stool withholding. Constipation is common but rarely dangerous. With the right diet, hydration, and simple remedies, most babies feel better quickly. Remember, it's not about how often your baby poops, but how comfortable and the soft stools are. And if you're worried or noticed warning signs, don't hesitate to talk to your pediatrician. See you in the next video. Thank you. Bye bye.